we heard news of the outbreak of the deadly disease, it seemed like something foreign, something that existed so far away. Well, at least it did. But as it spread to other countries, and we heard the increasing death tolls every day, the fears of many also increased with the statistics. But back home, there were still many others that doubted that this disease could ever get to Africa, talk less of our country, Nigeria. In an interesting twist of fate, Africa was indeed the last continent to be hit by the disease, and Nigeria was the first country in West Africa to contract it. They called it the coronavirus. At first, a lot of people did not see this as a deadly disease. There were lots of opinions on social media. Some said it was only a serious flu, which we could prevent by boosting our immunity. So, we were told that if we did a daily steam, drink a mixture of ginger, garlic, and lemon, alongside a lot of fruits, vegetables, and other sorts of concoctions, we will be fine. They also compared it to Ebola and Lassa fever, telling everyone that we had had worse illnesses to deal with. But still, the coronavirus spread very fast, with Lagos being the first hit, then Abuja following, until over 15 states in the country had a case. The government considered it an emergency and asked schools, churches, and even offices to close down. Everyone rushed to the stores to get plenty food that will last a long time. And because of the panic, everything became very expensive, leaving some people unable to afford even the basic food. Shortly after, we were all asked to stay indoors and to work from home, except the healthcare staff and other essential services. The coronavirus was like nothing we had ever seen, at least not in our generation. And to get rid of it, we need to act really fast. So, they gave us the do's and the don'ts, beginning with the golden rule. Stay at home. If you must go out, make sure to carry a hand sanitizer. Make sure to practice social distancing. Avoid crowded spaces. Avoid touching surfaces. Avoid touching your face, especially your eyes, nose, mouth, and ears. And if you suspect that yourself or anyone else has symptoms of the coronavirus, immediately call the NCDC helpline. Though they still don't have a cure, they can help with respirators and treatment of symptoms. But the most important of all, we have to pray. We must put aside all our religious differences and with one voice pray to the one who has the cure. Because you see, COVID-19 is no respecter of religion, class, or age. Even young people are reported to have caught and died from it. So now more than ever, we must stay at home as we have been ordered to, and do a sober reflection in humility and ask God to help us heal the world so that we can all live normal lives again.